Hello. Welcome to the September edition of the Critical Care Medicine video. My name is John Sevransky. I'm the editor-in-chief of Critical Care Medicine, and I'm truly fortunate to have Nuala Meyer, who is an associate editor for the journal, here to chat with me. In the September issue, there is an article by Krulak entitled Delirium Severity Trajectories in Critically Ill Adults Using the Intensive Care Delirium Screening Checklist, a Population-Based Cohort. There have been a number of articles on trajectories of various items, of various different diseases, and I wanted to ask Dr. Meyer, what is a clinical trajectory and why is it useful for identifying subphenotypes of patients?
Well, thanks so much for having me, John. It's really such a pleasure to be here. And when I think of clinical trajectory, I'm always thinking of literally the path the patient might be taking, kind of the path of their illness. And I think as clinicians, um, in many ways, this is the most important question we have for ourselves and for our patients, and that the patients are asking us kind of what will things look like in several days? What can I expect over the course of my illness? And so as I think about clinical trajectories, I'm really, in some ways, trying to predict the future and say, where is my patient going? And what events are they likely to experience? And if I could predict that well, it really informs a lot of the decisions we make about how aggressive to be in our care. I think patients and families are often asking us to predict kind of what the outcome will be. Will it be worth it to go through a lot of invasive procedures, knowing that they will survive and they will survive with minimal disability? So I think a lot of what we do in the ICU is try to imagine what the patient's trajectory will be. And the better we can estimate that, I think the better we can prognosticate for patients and families. And I think it really informs a lot of our interventions in the ICU.
And forgive me, I'm going to do something that I promised I wasn't going to do.
Sure.
Can you please link a clinical trajectory to a subphenotype?
What a great
And
question. So when I think about subphenotypes, I'm thinking about specific um, perhaps patterns of response within a syndrome or within a diagnostic group. So, for instance, in ARDS, Carolyn Kelfie, has really very well validated that if we use plasma protein markers in concert with a lot of our clinical data, we can observe one subphenotype or one pattern of response that's really characterized by a lot of systemic inflammation and often worse shock, lower bicarbonate. And that hyperinflammatory subgroup, as it's often called, seems to behave differently than less inflamed, less systemically inflamed patients, at least in the context of some randomized trials, including recently Pratik Sinha showed this for activated protein C. So a subphenotype, I think of inching towards the holy grail of endotype, which I think is maybe a biologically determined pattern of response. A clinical trajectory, I'm really thinking more about how someone is behaving over time. So I think that the time factor really is important. And one might imagine that you might actually start in, say, a hyperinflammatory subphenotype, but improve. And maybe even your plasma markers will regress towards a less inflamed subphenotype. And I think some investigators have demonstrated this, and that it's probably more important where you're moving to. So if you start less inflamed but become more inflamed, you're becoming a higher risk group for poor outcomes. And the converse is also true. If you start very hyperinflamed but improve quickly, you tend to have better outcomes. So I think they are related, but not interchangeable. This idea of a trajectory, kind of the path you're going, versus your subphenotype, your pattern of response.
Thank you. That is quite helpful. And if I might ask, how would a clinician or potentially a researcher use a clinical trajectory in their work if they can at all?
Yes. I think we do this every day. I think it's the bread and butter of what we do as folks who practice in the intensive care unit. I think we are frequently asking ourselves, is my patient improving? And if so, kind of what steps have I taken to help them improve, and can I maximize that? If they're not improving, what steps should I take? Should I stop a certain intervention, or should I add something? Should I escalate the intensity of what I'm doing? So I really think clinical trajectories are part and parcel of all of our routine clinical care. From a research standpoint, I think we are so interested in being able to predict trajectories, because what's so challenging is patients can look equally sick on day 0 and a day or two later have very different outcomes. And we treated them the same on day 0. We gave the right antibiotics. We thought we resuscitated to adequate perfusion markers, and yet the outcomes are different. So perhaps if we could predict this better with the information we have on day 0, I think that would be very informative to our patients and their families. And it would let us then try to investigate what are the mechanisms behind these different patterns. So we do that retroactively, I think, and we try to infer the information we can obtain from day 0 and say, is there any way I would have known where this person would be 4 days from now? And if we can understand those mechanistic differences, maybe that would inform our next interventional trial, where we say in a precise way, you look like your pattern is different, and I predict you're going in the wrong direction. So you're really high risk, and I'd like to enroll you into a trial to test whether this specific therapy would help. There's a lot of work going on in this area. I don't think we don't yet have the predictive information to know it precisely who's going to take which path, but I think that's very much the goal of precision medicine in the ICU.
Well, thank you very much, Dr. Meyer. You've taught me some things, and I hope you've taught our listeners also some things too. So if you're interested in learning more about delirium severity trajectories, please take a look at the September issue of Critical Care Medicine. And I hope you all have a fine day. Thank you.
Thank you.